CNBC-TV18 presents Building India's Healthcare Edge in association with Cororo Health.
Hello and welcome to Building India's Healthcare Edge presented by Corro Health and CNBC-TV18. I'm Ridhima Bhatnagar. India's rapidly evolving healthcare landscape demands smarter technology-enabled financial solutions. Corro Health plays a vital role in this transformation, streamlining revenue cycles and empowering providers to deliver quality care with stronger financial sustainability. A leading provider of clinically led healthcare analytics and technology-driven solutions, Corro Health is dedicated to positively impacting financial performance for physicians, hospitals, and health plans. Corro Health was named one of the 150 top places to work in healthcare in 2025 by Becker's Healthcare and a great place to work certified in India not once but twice. The company's global presence extends over 10 locations, including the United States, India, and the United Kingdom. And joining us today, we have two very special guests. We have the CEO of Corro Health, Patrick Leonard, fondly referred to as Pat, as a leader with decades of expertise in healthcare technology and revenue cycle management. We also have with us Corro Health's Country General Manager, Yadvinder Singh Jaspal, popularly known as UD. A progressive leader with over 25 years of experience, UD is known for focusing on driving sustainable growth through integrated strategy, operations, and technology to deliver impactful experiences for customers, employees, and even partners. So Pat and UD, thank you so much for taking out the time and joining us. And thank you for doing this for us as well.
Yeah, thank you for having us.
Thank you, Ridhima.
I really hope that this will be a very riveting conversation, and we'll of course have a lot to learn and discover as we go through this conversation. But why don't I kickstart things off with you, Pat? Okay. Let's go back to 2020 so that we also have some context setting for our audience as well when Corro Health was formed, right? So from 2020 to now, how do you see yourself or how do you position yourself in the market and industry at large?
Yeah, well, thank you for the question. And it's really been an amazing journey. We started out with a very aggressive organic and inorganic strategy to really transform healthcare.
Yeah.
As part of that strategy, we've acquired 12 companies to date. Our team member count has grown to 17,000, both India as well as in the US. And really, we think we've developed a differentiated platform that focuses on three key pillars: automation and technology, data-driven analytics, and clinical expertise. And we think those three pillars are really what differentiates us in the market and really delivers exceptional results for our partners, our customers, our providers, as well as payers.
UD, I want to bring you also in the conversation. I have a two-part question. I want to understand, one, what makes Corro Health a great place to work, but also with the advancement of technology, how are you ensuring that it enables you keeping that title, but also in a way, some challenges that you see along the way as well?
Right. Thank you for the question, Ridhima. What makes us a great place to work is our employees, because the experience being part of the organization, and then they go and vote for us year after year. But what we do to enable that to happen is focus on three key areas. First is we have 52% female employees, so employee safety becomes a critical area for us. Second is how do we create an environment where we can ensure that people are able to efficiently perform. So that drives job satisfaction directly. And third is happiness. Happiness of employees is critical, right? Yeah. So whatever they do, they need to feel happy about it. So those are the three areas we continue to focus. And of course, the results are coming, and we are liking those, and we want to continue on this journey. When it comes to technology, the second part of your question, yeah, I think it is coming as a big support factor for us because it is cutting down a lot of mundane jobs which were boring, monotonous. People were not liking doing the same job over and over again. It is helping bring a lot of innovation to work.
Yeah.
It is definitely improving productivity standards. It is improving the quality of work that we are doing. So all that is making the job easier and more exciting, and that's what employees love.
But I also want to do an overall understanding of the sector at large as well. not just today, for a few years from now, hospitals have been facing unprecedented financial pressure, right? But the approach, the strategy, the mindset in 2026 for you to survive will be very, very different, right? The traditional cost-cutting mindset would not be feasible in 2026. How are you approaching that challenge as you go forward?
I think health systems, whether it's in the US or really anywhere in the world, are under tremendous financial pressure. I think historically, to your point, cost-cutting has been the primary strategy, which is a great short-term strategy, but not long-term sustainable. And I think what we're seeing as a result of that cost-cutting is you are seeing particularly physicians that are overworked. I think you're also seeing the delivery of care being diminished as a result of that, because you can only cut costs so much. And so really, at Corro, we're focused on, we do believe cost cutting is part of it, and that's where I think our technology comes in. But we also believe that top line growth is really how you get sustainable success.
Yeah.
And that's really where we're focused with a lot of the offerings that we have, is making sure that the work being performed is being paid appropriately, and you're driving that top line growth. So it's not just continuing to cut costs, which is, again, not a long-term sustainable strategy.
And just bringing that to the Indian context,
Sure.
I think in India also the times are changing. It's gone are the days when cost arbitrage was the only factor to bring work to India. I think it's the innovation, it's the deep domain expertise today that really is helping the company perform better.
Gentlemen, I want to now shift our focus to what's being called the big buzzword. It's been there for a while, which is artificial intelligence, right? So Pat, I want to understand first from you, from an overall perspective again, one, how do you see the hype around artificial intelligence? And in the second part, I also want to understand again from a perspective of healthcare companies, especially with revenue cost model companies, right? I want to understand, how do you distinguish? There is a lot of noise, there is a lot of substance, right? So how do you differentiate between the two as well?
Yeah, no, another great question, and certainly there's tremendous hype in the market. I think any company that you talk to, you hear that automation is a key part of their strategy, and I think the reality is, I think it does need to be a key strategy for any company out there. The question is, where are they on that journey? And I think that's really what makes it difficult for customers to kind of filter through in terms of what's real, what's not real. I think at Corro, what we focus on is measurable results. So what's the technology we're using? Is it driving the results? And I think the way we think about automation is it does have a different role depending on the job we're performing. In some cases, automation performs elimination of the work, right? Can we completely automate the work that's being done? In other cases, it's to supplement the work that's being done. Two examples, we have a platform called Pulse, which is drives automation for 85-90% of the work that runs through that. So that's without human touch. We have another platform called Vision, which is more for the review of like inpatient clinical charts. And some of those charts can be 800 pages to 1,000 pages long. So really there, it's more supplementing the clinicians that are reviewing those charts and assisting them from that standpoint. But measurable results is really a key part. I think the other thing is really just understanding the types of automation. And another good example on that is automation that we spent probably 2 years building that supported that Pulse platform. Today, the evolution of automation, that same automation, can be built within a 90-day time frame.
Yuri, coming back to you and just understanding again from an organization perspective, because diversity plays a very big factor in a scenario like this, not just in terms of your employees at your workplace, but also at large, how do you serve communities? So how are you keeping the aspect of diversity from that perspective?
No, thank you. Thank you for asking that, because it is something which is very, very critical for us, and we pay a lot of attention to this particular area. I mean, since I mentioned 52% of our overall employees is female employees, 40% of leadership comprises of female leaders. Those are all good numbers to have. But when it comes to communities and how do we provide services to the community, I think our belief is it is not just the money, but also the time, the gratitude and efforts that we need to take back to the communities. If I just talk about year 2025, our employees have spent more than 2,000 man hours of community service work.
Yeah.
We plan to do that or even more for year 2026.
Yeah.
We have actually diversified and invested in several corporate social responsibility projects, ranging from building urban forests to supporting old age homes.
Yeah.
To even helping children with special abilities for their education and healthcare.
lovely. Yeah.
So I think, and of course, we are doing this across 4 different locations today
Okay.
in Noida, Bangalore, Chennai, and Hyderabad. So that way, we are trying to bring different services back to the communities and help them in every possible manner.
How
I was
lovely.
going to say we have a corporate responsibility, I think, to give back. But I think if that's all we're doing, I think it falls short. So I think what Yudi is referencing is really a lot of the work we do from a community standpoint comes from within the organization.
CNBC TV18 presents Building India's Healthcare Edge in association with Corro Health.
We spoke about your presence, of course, your
Yeah.
big markets like United States, United Kingdom presence in India as well. But of course, every year you have new ambitions and you're looking at expanding and diversifying as well, right? You've made a significant investment in Santecture. So I want to understand, how are you seeing Middle East as a new market and what are the kind of possibilities that you see there?
No, we see healthcare, the challenges facing healthcare is a global problem, not just a problem within the U.S. So the Middle East is a very attractive market, I think, in terms of, if you look, I would say from an evolution standpoint, they're a couple years behind where the U.S. has been in their the development of healthcare, from a payer standpoint and so forth. And actually, that's a good thing, because there's a lot of things we've done in the U.S. that you probably wouldn't want to replicate. And so it's a market that I think has a high aptitude for technology and a desire to kind of leapfrog. So learn from what's happened in the U.S. and how do we enable with technology and maybe do something different. So we're very excited about the market just in terms of being able to leverage some of the technology that we have. We think it'll be highly relevant there. But we also recognize it's a different market, which brings to the investment with Santecture.
Yeah.
It's a Dubai-based company. They've been in the market. They know the market. The market operates differently. So
Correct.
between the two of us, I think partnering, we're very excited about the opportunities that present itself. And I think from that standpoint, we'll look even beyond the Middle East from that standpoint. Because again, the challenges facing healthcare and unsustainable cost and things like that, it impacts every country in the world. And so we're excited about the future, but initially we're focused on the Middle East right now.
I just want to say this, when we read about your company, the first word that stands out, you say we're a curious company, right?
Yes.
And that's lovely to hear, because that kind of shows in the kind of data that you're putting out as well.
Absolutely. No, absolutely. I mean, so we get these questions on a daily basis, right? How is this going to change my job? How is am I supposed to be, doing something different? How can I prepare myself for that? So what we do is actually we are investing heavily in retrainings and upskilling the employees, because they need to do things differently as the days progress.
Yeah.
Like Pat was talking about Pulse as an autonomous coding solution, right? We were able to automate 90% of the transactions. So the coders who were manually doing these transactions in the past are not required to do this anymore. And what we did as a result was we upskilled them to actually start working on quality auditing process and also start finding more solutions that we can offer to the clients, which can ultimately improve the quality of the output that we provide to the end customers. So I think it is all about making the right investments, talking to the employees, don't make them scared with this change, which is inevitable, it is coming. Work hand in glove, look at opportunities and look at their skill sets and how we can develop those skill sets for the upcoming job opportunities that will come our way.
Yeah.
That's what we are doing right now.
I want to understand how Corro Health helping hospitals in, for the lack of a better word, a seismic shift that is happening, which is fee for service that moves on to a change for value-based care. How are you ensuring that transition happens?
Yeah, I mean, this is a good example of where to learn from the U.S. and maybe start to do something a little bit different. So you're right, there is a seismic shift to value-based care. And if you think about the two environments in which we operate, our healthcare systems operate in the U.S. We have what's called fee for service, which is paying based on work that's performed, and then value-based care, which is paying based on outcomes, which makes a ton of sense in terms of managing patients and ensuring their health and being proactive in their the delivery of healthcare and so forth. But it's a paradigm shift because you have a community that has been paid historically based on the work that's performed. And what you're saying in some aspects, it's how do we manage that patient more efficiently going forward? And so the compensation system starts to evolve from that standpoint. But probably most importantly, the tools with which you manage patients under a value-based care environment versus fee-for-service, totally different. Because really what you're looking at from a value-based care standpoint is what's the history of that patient? So you're going back and looking at that clinical history, and you're identifying conditions that may exist with that patient that you want to surface, that you can provide proactive outreach to that patient to ensure you're taking the right steps to ensure that patient stays healthy and not being reactive where that patient's coming into the health system and incurring costs from that standpoint.
Yuri, I want to bring you back in the conversation. You were, of course, speaking about leveraging India, not just as a market, but for the workplace in terms of the talent pool as well, right? So I want to understand again from an India perspective, how are you leveraging the talent pool that you're seeing in India?
I think India has really wonderful workforce to offer, right? Young, talented, well-educated, very hardworking. As Cororo Health, what we do is we run our own training programs as well as certification programs. Why we do that is because we need to upskill the people that we hire from the market and make them ready to take on US healthcare domain knowledge, which is important for them to do their job and excel in that. So I think these training programs, as soon as the employees join the organization, they undergo those extensive training programs, undergo the certification programs, which are fully sponsored by the organization, which does not just make them job ready, but also help them establish their career over a period of time. And I think that has been a big change, that we have been doing from our end. Not just hiring people with the right expertise, but also building that expertise within, and leveraging that for the benefit of both the employees as well as the organization.
I would say too, there's just an amazing desire to learn. So I mean, we could provide the training curriculum, the opportunities, but without that desire to learn and challenge themselves, we wouldn't be as successful. And so we see that as a tremendous opportunity. And I think we've seen that same as we pivot to the Middle East market, which there are differences from the US, but the appetite to take on that challenge exists, and to me that's exciting.
Pat, I want to understand from you, from an organization perspective again, how are you adopting and seeing more AI-powered solutions as you move forward as well?
Now, as I mentioned, I mean, the market is just moving so fast in terms of the development of automation and the use cases around that. And so we take that very serious in terms of just our ability to make sure we're staying in touch with the market and we're being as current or using the most contemporary forms of automation. The one thing I would caution, I caution our customers, I'd caution the audience as well, is automation needs to be part of the playbook, but it's not the playbook. And so in healthcare, there's just too much complexity out there that it's rare to find a situation where automation solves that problem 100% of the time. And so that gets back to how we think about our automation and the use cases. Is this for elimination of work? Is this for supplementing work and making sure we're optimizing it? We're very fortunate at Corro that with the large team we have and the work we do for both payers and providers, we have kind of our own test environment in terms of our automation. And so that's how we perfect it, and we make sure it's driving the results because we're working in that environment. But a good example of how we've evolved based on kind of market needs is a lot of that technology that we've developed internally, now we make customer facing. And so I think what you're seeing from the market is not only this desire to partner with them and help them out and maybe outsource some work, but it's how do I have access to that technology so that I'm also running my internal operation more efficiently. And so we've evolved a lot of our technology not only for internal use, but for commercial or SaaS use as well. So
And with
it's
our
exciting
employees,
times.
I mean, if I just may add, with our employees, we are talking about a very common word these days: become AI fluent.
Yeah.
What it truly and what we're trying to tell them is, don't just work on putting these solutions into execution,
Yeah.
but also work towards building the solutions.
Yeah.
So I think it's a long journey. I think the work on this has started, and I'm sure we will do well as the days progress.
Lovely. Yuri, I'll give you the final word. Just a piece of advice for young professionals or people who've just started their career handling with the revenue cycle management. What would be that one piece of advice for them in this very challenging but evolving landscape of today?
I think those who want to start their career or want to build their career in healthcare space, one, always be focused towards domain expertise,
Yeah.
because this is a highly domain-centric industry. Of course, there are ways we provide the domain expertise and people can learn and adapt. And second is, again, like I mentioned, try to start challenging the status quo.
Yeah.
Look at why it is being done in a certain way. Why can't things be done differently? Come up with smarter ideas, innovate every day. Just bring that curiosity to work, and I'm sure you will succeed. So that is the mantra I always probably share with all the employees.
How lovely. Final word from you, Pat?
Yeah, no, I agree with everything Yudi said. To me, it's, embrace technology, embrace the opportunity. The world, the market is evolving quickly, and I think being able to embrace that, there's so much opportunity that's out there, and being willing to tackle that is just going to create great career opportunity for young professionals.
Lovely. Pat and Yuri, it's been such a pleasure having this conversation and for me to learn so much from both of you as well. So thank you so much.
Thank you.
Thank you.
Really appreciate it.
With that, we've come to an end of this riveting conversation. This is all that we had on Building India's Healthcare Edge, presented by Corro Health and CNBC-TV18. Once again, thanks a lot for watching.
CNBC TV18 presents Building India's Healthcare Edge in association with Corro Health.